Now let's look at dementia, which is different from delirium. Dementia is a more subtle and gradual decrease in cognition, with no change in the level of consciousness or EEG readings. The hallmark here is memory loss, but you can also see aphasia, apraxia, where a person can't follow a command even though they understand it and have an intact musculoskeletal system. Agnosia, which is the inability to recognize things. Loss of abstract thought, personality changes, and impaired judgment. Another important distinction is that while delirium is reversible, dementia is often irreversible. Causes of dementia include Alzheimer's disease, Lewy body dementia, and other diseases that cause a gradual decline in brain function. Reversible causes include normal pressure, hydrocephalus, vitamin B12 deficiency, and other diseases that can cause reversible changes to the function of the brain. As we said, patients will usually have a normal EEG because there's nothing acute going on like in delirium. You also want to be on the lookout for depression in the elderly, which can look like dementia and is called pseudo-dementia. So this is really just depression in the elderly. And it's possibly reversible. If you have an elderly patient who presents with confusion, whose orientation is restored after replacement of fluids, did they have delirium or dementia? The answer is they had delirium, most likely secondary to dehydration. So notice how delirium was different from dementia here. It was acute, it was reversible, and there was a change in the person's consciousness. Next is psychosis, which is a fairly broad term that refers to a distorted perception of reality. And this involves delusions, which are false, persistent beliefs, like believing that your spouse is really an alien in disguise. Hallucinations, which are perceptions in the absence of external stimuli. And also, there can be disorganized speech, where words are strung together while ignoring their meaning. This is also referred to as loose association. So if a patient said they can see their great-great-grandfather sitting next to them, which sign of psychosis would this be? This would be a hallucination, because their great-great-grandfather is not really sitting next to them. There is an absence of external stimuli, but they are perceiving something that's not there. It's often seen in psychotic disorders such as schizophrenia, delusional disorder, but it can also be seen as a symptom of mania, depression, general medical conditions, or substance abuse. Okay, flash quiz. Dementia is blank, reversible or irreversible, whereas delirium is blank, reversible or irreversible. Dementia is irreversible and delirium is reversible. So remember that dementia, which is irreversible, is more gradual, and causes usually include things that cause physical damage to the brain tissue, whereas delirium, which is reversible, is acute and usually causes functional disturbances in the brain. So, physical damage to brain in dementia and functional disturbances to the brain in delirium. There are hallucinations associated with every sense. It's important to understand which types of hallucinations are associated with different pathological processes. For example, visual hallucinations, such as the grandfather that wasn't there, is often seen in patients experiencing a medical illness like drug intoxication or delirium. Do you remember which type of hallucination is common in people with schizophrenia? The answer is auditory. Though many patients may also have visual hallucinations, these are less common as compared to in delirium. So, visual hallucinations more common in delirium and auditory hallucinations more common in schizophrenia. And these auditory hallucinations often take the form of disembodied voices that the patient hears talking to them alone. Then there's olfactory hallucinations, which are usually seen in the aura of a seizure in epileptics or patients with brain tumors. Gustatory hallucinations are pretty rare, so we'll skip those. Tactile hallucinations are also possible, and they're classically seen in withdrawal from alcohol and abuse of cocaine. In both cases, you may hear these hallucinations described as formication, which refers to the sensation of ants or bugs crawling on one's skin, and this comes from the Latin word formica, which means ant. And you thought all those years of high school Latin were a waste. Hallucinations can also be associated with sleep, and those hallucinations that happen as one is going to sleep are referred to as hypnagogic. And the way I remember that is the go in hypnagogic matches the go in going to sleep. And there are also hypnopompic hallucinations, which occur while waking from sleep, and you can remember that with the mnemonic pompous upon wakening. Schizophrenia is a very high-yield disorder, so make sure to understand it well. As with many psychiatric illnesses, there is a wide set of diagnostic criteria that you should be familiar with to make the diagnosis. Usually, this requires you to remember 4 things. The distinct criteria that are included. So 1 is the criteria. 2 is the length of time required to make the diagnosis. 3 is the different subtypes of the disease. And 4 are related diseases. So these are the 4 things you have to know when trying to make a diagnosis in psychiatry. And most of this framework comes from the Diagnostic and Statistic Manual of Mental Disorders, or the DSM. This is the consensus text on how to define and speak about mental illness. When clinicians discuss mental illness, this is usually the source for definitions of commonly used terms, and the same applies for the information in first aid. So, starting off with schizophrenia, it's a chronic mental disorder defined by periods of psychosis and disturbed behavior and thought that last for greater than 6 months. So that's the length of time there. It's thought to be caused by increased dopaminergic activity, and patients with schizophrenia have decreased dendritic branching of their neurons as well. Schizophrenia is caused by a combination of genetic and environmental factors. Marijuana use has been shown to increase the risk of schizophrenia in teens. So to make the diagnosis, you need 2 of the following 5 criteria at a minimum. They include delusions, hallucinations, and you remember which kind of hallucinations are associated with schizophrenia? Auditory. Disorganized speech is also known as what? loose associations. Remember this, loose associations. Disorganized or catatonic behavior, and the following negative symptoms. Now, you have to have all of these negative symptoms in order to be counted as one criterion of diagnosis. And these negative symptoms include flat affect, social withdrawal, lack of motivation, or lack of speech or thought. Your exam may present to you a patient with these symptoms, but if it hasn't been 6 months yet, the diagnosis of schizophrenia cannot yet be made. So you have to have at least 2 of the 5, and it has to be going on for at least 6 months. Now, if the symptoms only last up to 1 month, what will this be considered? This is considered a brief psychotic disorder. And if it lasts 1 to 6 months, what would this be considered? This would be called schizophreniform disorder. We'll also discuss other types of psychotic disorders, such as schizoaffective disorder, more when we get to the first aid section on keeping schizo straight. The next clinical entity we're going to look at is delusional disorder, and it can sometimes be difficult to differentiate this from schizophrenia. So delusional disorder refers to a patient with a fixed, persistent, untrue belief that lasts for greater than a month. However, their day-to-day functioning tends to be intact. Imagine a married businessman who is successfully carrying out his work, but he holds delusions that his only child wants to kill him. He may carry this delusion and may make adjustments in his life to avoid his child, but otherwise he carries this delusion without any serious consequences on his day-to-day functioning. So that would differentiate this from schizophrenia, because schizophrenias do have a limitation in their functioning day to day. So a high yield way to identify this entity in step 1 question is vignettes usually identify a patient with only a single belief or fixation, as opposed to patients with delirium or true schizophrenia that may be described as having multiple bizarre beliefs. Remember though that delusions are one of the diagnostic criteria of schizophrenia. So if a person has delusions and also any of the other 4 criteria we mentioned for a period of 6 months, then you'll have to make the diagnosis of schizophrenia. Okay, now let's look at dissociative disorders. Now, do you remember when we discussed dissociation as an immature defense mechanism? We said it refers to a temporary, drastic disruption in personality, memory, or consciousness of an individual to avoid stress. That was the purpose of the immature defense mechanism. It's to deal with stress. Now, extreme forms of this defense mechanism manifest as the following disorders, one of them being dissociative identity disorder, which was formerly known as multiple personality disorder. And here, individuals develop multiple distinct identities. It's usually more common in women and classically occurs in patients with a history of sexual abuse. Depersonalization or derealization disorder is where a patient has persistent feelings of detachment or estrangement from one's own body. Patients often complain about feeling like they are going through the motions of their day-to-day activities. A good high-yield way to identify this disorder in vignettes is to look for an individual who experiences extreme stress but seems apathetic or unaffected by it. Such a person, for example, who lost their job or their house or significant other but doesn't seem to care at all, would be diagnosed with depersonalization or derealization disorder. Of course, we're assuming here that the person valued these things or people in the first place. Alright, flash quiz, true or false. Schizophrenia is associated with decreased adrenergic activity in the brain. Answer, false. Schizophrenia is associated with increased dopaminergic activity in the brain. There was no mention of adrenergic activity. Also remember that there is decreased dendritic branching of the neurons.